Hello, I'm Stephen Davis, founder of Patient Alert. Patient Alert addresses the catastrophic problem of hospital-acquired conditions. Simply defined, HACs are severe, largely preventable medical complications resulting from hospital treatment. Annually, HACs affect over 1.7 million patients, result in nearly 100,000 deaths, and because HACs are non-reimbursable, cost the healthcare industry up to $45 billion annually. To date, various physical signage systems have been devised to communicate critical patient information to clinicians. However, due to HIPAA, facilities are forbidden from clearly identifying patient conditions and instead utilize non-standard collections of colored symbols. One example is Peter Pepper's Icon Healthcare Alert. When a patient is checked into a room, a clinician identifies the conditions relative to that particular patient, and then also provides additional isolation warning inserts as needed. However, these existing solutions have three critical limitations. One, there's no standardization of symbols and no explanatory text. Patient condition symbols are often represented differently by different manufacturers, and if these symbols are misinterpreted, the patient care provided can be harmful rather than preventative. Number two, the sign can only be updated at the point of contact. And most importantly, number three, the sign cannot advise caregivers on best practices. Patient Alert solves these problems, thus reducing HACs with a patent-pending, cloud-based digital signage system. Consisting of industry-standardized icons and best practices checklists, the Patient Alert software runs on commercially available hardware. Prior to anyone actually occupying the room, there's quite a bit of digital real estate, and the facility can therefore use it to promote itself with any awards or updates to the facility. However, once a patient is entered into the room, the clinician will tap the screen, enter their unique PIN, and they're then presented with a series of patient condition icons with corresponding text. This then alleviates any confusion they might have in choosing the appropriate icons. When the clinician has appropriately identified all icons he or she wishes to display, they'll then be shown a series of isolation warnings, at which point, if it's appropriate, they can choose the correct isolation warning, and when they hit enter, the screen now goes into public display mode. You'll notice that in this mode, while the icons are still displayed, there is no corresponding text. This now makes the screen HIPAA compliant. The next time a clinician goes to interface with the Patient Alert system, they'll tap the screen, go ahead and enter their unique PIN, and this time around, they're actually presented with information regarding themselves, the patient, and the date and time, and once more the symbols are shown, however this time with the appropriate text identifying the conditions. The clinician then taps the checklist and is asked whether they want to complete the checklist, and at that point, the Patient Alert system generates an appropriate checklist on the fly for whichever conditions were actually chosen for that patient. The clinician then carefully executes that checklist and hits enter, at which point they've been notified the status of their checklist is complete. When the clinician hits enter one more time, this is then stored in the cloud, and Patient Alert returns to its public display mode. You may recall that I identified three problems with traditional physical signage. Patient Alert remedies each issue. First, to address standardization, I've enlisted renowned semiotician Mies Ora, who is commissioned by the Robert Woods Johnson Foundation to create the Universal Symbols healthcare set. Mr. Ora is the only semiotician to have his healthcare icons implemented worldwide. Second, the use of digital signage will not only allow the updates to occur at the point of patient care, but also remotely via the web. If a lab result indicates the presence of a new condition, the update can now be made either at the point of patient care, the nurse's station, or even a physician's office. And third, to improve patient care, Patient Alert will present and track the completion of best practices checklists. The CDC reports that best practices can save up to 70,000 lives and reduce the healthcare industry's financial burden by as much as $25 billion annually. To develop these checklists, I've enlisted Dr. George Nelson, a Vanderbilt infection preventionist, formerly with the CDC. In addition to Dr. Nelson, Patient Alert has the support of Mike Collins, a Vanderbilt Technology Transfer Board member, and Rigved Yoshi, Director of New Ventures at Vanderbilt University. Finally, to better manage the rapid growth and deployment of Patient Alert, I have a preferred vendor agreement with Uniguest, a Nashville-based digital signage provider currently servicing 17,000 locations in 42 countries. Again, my name is Stephen Davis. Please contact me for more information or to see a demonstration of the Patient Alert prototype. Thank you for your time.